Hello, today I'll be talking about the cares of a HemoVac drain and a Jason Pratt drain or a JP drain. So first I'll be talking about the HemoVac drain. So first we're gonna obviously verify that that's what we're doing. We're doing that care. So we're gonna obviously we're gonna give the patient privacy, perform hand hygiene before starting the procedure, let the patient know what we're doing. Then we're gonna get the patient up to a comfortable position where the drain is at an easily accessible site, preferably below the drain site. And then we're gonna grab a waterproof like pad, like a towel or like a chuck, and then place it underneath the drain, so that just in case like any of the fluid leaks or anything. And then we're gonna don the appropriate stuff that we need to put on for the procedure. And then using sterile technique, we're gonna open up the gauze pad with making sure that we open it in a sense that the inside isn't obstructed in any way that would de-sterilize the procedure. So we'd open up the thing and then place it off to the side without touching the inside or anything like that, so it stays sterile. And then we're gonna grab a container to get the drain fluid from, and then we're gonna lift it up by the HemoVac drain, and without contaminating the outlet, we're gonna pull the cap off the top of the HemoVac drain. And then after that, we're obviously gonna empty the HemoVac drain contents into the graduated cylinder, obviously. And then after that, we're gonna, and obviously when you're doing it, you have to kind of squeeze on it because some of the fluid won't come out unless you squeeze it. And then you're gonna wipe the top of the drain with that sterile gauze pad that you had. And then after that, you're gonna squeeze the HemoVac drain completely, so that the top and bottom are completely compressed before you recap the HemoVac drain, because it won't be able to pull the fluid out if it's completely uncompressed. So you gotta completely compress it before you apply, and then obviously reapply the cap. Also, we want to make sure that the tubing for the HemoVac drain is unkinked and there's nothing pulling at the site of the wound or really anything like that. And then we're gonna check the tubing at the insertion site around the sutures to make sure there's no tension kind of pulling on the sutures at all. After that, we're gonna look at the graduated cylinder contents, and then we're gonna record everything, the characteristic of it, its color, the amount, and we're gonna make note of that, and then we're gonna discard it, obviously according to however the places do it. Different places do it differently. Next, we're gonna put on clean gloves. We're gonna don clean gloves again after we perform hand hygiene, of course. And then we're gonna, if there's a dressing on the site, we're gonna take the dressing off, clean it obviously with the right kind of method. And then we're gonna include cleaning the sutures off with gauze, but with sterile saline. So we're gonna put the saline on the gauze, and then we're gonna clean it, either a little device to hold it so that we're not touching it. Obviously, and if the drain site is open to air, we're gonna look at the sutures to make sure that there's no signs of infection, redness, signs of pulling at the site or swelling. Then we're gonna if we need to put a new pad on, we'll put a new dressing on, and then we'll just dry it with a new. Actually, before we do that, we're gonna dry the place that we cleaned with a new gauze pad, and then put the dressing on. And then if we need to put any skin protectants on, we'll put some skin protectants on, and then we'll discard all the soil supplies. So that's it for the HemoVac drain. Next, we have the Jackson Pratt drain, or the JP drain. So first, the procedure starts off kind of the same. We're going to verify the order that we need to do, carrying of the JP drain. We're going to perform the skill by providing privacy, performing hand hygiene, donning gloves, explaining the procedure to the patient, and obviously gathering the correct equipment that we need. Then we're gonna identify their wristband, whatever 2 identifiers. And then we're gonna do with the same thing with the HemoVac drain. We're gonna put them in a position that's comfortable for both the patient and the person providing care, so that's easy for both. And then we're also going to don the appropriate personal protective equipment as well. Next, we're going to, so for the JP drain, it's covered by a bunch of tape and an ABD pad or whatever. So to do the care of the JP drain, we first have to remove the dressing. So with the removal of the dressing, we want to make sure that we're performing the push-pull method. So when we're taking off the tape on the skin, we're going to pull it off in the direction of the skin, so to minimize the damage to the skin, while also when you're pulling off the tape, you're going to push the skin away from it as well, so there's not as much like damage done to the skin. So you're gonna carefully remove the dressing tape by doing the push-pull method to prevent a medical assisted adhesive skin injury, MARSI. So and then you're gonna obviously remove from the sides first, and then the middle, and then obviously remove the pads. When we're looking at the pads, though, we want to make sure that the drain like if there's any like fluid on the dressing, that we make note of that before we throw it out. Things like blood, pus, stuff like that. And if there's any like part of the dressing that's like sticking to the patient, and you know, like if you pull it off, it's gonna hurt the patient even more, you're gonna want to help loosen the dressing up with some sterile saline. So you kind of pour the sterile saline on the pad, and then that'll help kind of loosen it up, and then you can try to remove it with a little bit less resistance. Obviously, put the soiled contents inside of the proper containers. And then you're going to want to inspect the drain site. Look for things like if there's any pain, any redness, swelling, sutures are intact. Now you're going to remove your gloves and then perform hand hygiene, and then prepare for the next procedure, which is actually cleaning the area around the drain. So you're gonna have to use sterile technique for this. So you need to like a sterile area, sterile like supplies, stuff like that. And then we're gonna open the solution, pour it into like a container, and then soak gauze pads or sponges inside of the container to kind of get it all saturated. And then after that, we're gonna put on sterile gloves, and then we're gonna cleanse the site of we're gonna cleanse the drain site. So a couple of things with that: we're not gonna touch the sterile pads, the sterile gauze pads, with just our hands. We're gonna have to use either forceps or what are those called, the cotton tipped applicators, to move to clean. And also with the cleaning, we're gonna have to do the cleaning in a specific way, starting at the center or the skin right around the drain site and moving in a circular motion around the drain, moving peripherally or outwards. And we're not gonna reuse the gauze that we did to make a full rotation. We're gonna discard all the old gauze after we're all done with the first whole cycle, and then you're gonna use a new gauze pad every single time that you go back to the center until the site is clean. Then after that, you're gonna dry the skin with the gauze pads in the same manner, kind of using the forceps, cotton tip applicators. We're gonna apply some skin protectant if needed. And then we're gonna make sure that the pre-split drain sponge under and around the drain is under and around the drain, and that the safety pin that's holding the drain is intact as well. If you need to use a new safety pin, then obviously remove the safety pin. If it's crusted, you're gonna have to remove it and then get a new sterile pin, put it back in, and obviously take care not to dislodge the drain. After that, you're gonna put new gauze pads around the site of the drain, and then over the gauze pads, you're gonna put a new ABD or whatever pad you're using, and then tape it up from the center, and then on the sides as well, sides, top, sides, and then discard all the soiled supplies that you use, the gauze, whatever, perform hand hygiene, and then document all that stuff that you did. All right, thank you.